the cure for cancer. That must just about be the holy grail for people in the biotechnology and pharmaceutical space. How are we doing? Are we getting closer?
Well, one of the important ways to treat cancer and to stop it being fatal, of course, is to detect it early. And there's a lot of work being done in the area of cancer diagnostics to revolutionize the way that cancers are detected as early as possible, so that that can allow some of the very good treatments that we now have to be able to be effective.
There was news recently about a world-first blood test for melanomas. Is that really such a big deal?
It's really an example of the new wave of advances in diagnostics, which are called liquid biopsy. Currently, the gold standard for cancer diagnosis is to take a tissue section. So in other words, to do some surgery on a patient, to take a sample of the tissue or the tumour that's suspected, and to examine it in the laboratory. The problem with that, of course, is that you have to have a tumour there to be able to work it out, first of all. The term liquid biopsy refers to using liquids like blood or saliva or urine as the sample to test for the presence of cancer, really before it gets a foothold. So the researchers from Queensland that talked about their discovery of this melanoma test are using a liquid biopsy approach. So what they're doing is they are taking blood from a patient and testing it for what's called microRNA, which is one of the many things that cancers have and normal cells have in them. But there are specific types of microRNAs that are indicative of cancer. And what they've found is a small number of these that together can tell the story as to whether the patient has a tumour or not at quite an early stage. So yes, it's an exciting advance, but they're not the only group doing this sort of work. There are lots of other researchers and companies developing the liquid biopsy space, and it's really seen as the new wave of screening and testing for cancer to lead to a much earlier treatment and therefore a more likely cure.